My husband and I decided we were ready to have children. So we started out, like every couple does, just trying naturally. And after about a year of trying, we still were not pregnant. So our first stop was a fertility specialist. They basically told me that I couldn't get pregnant naturally, that I had to have help.
They basically said our only treatment was IVF at that point. We obviously both wanted kids, but the amount of money that it takes to do IVF is obviously a deterrent.
We did our first round of IVF and it failed. Try again. Obviously it cost a lot of money and it was heartbreaking. So at that point in time, I really just took a step back and I said, I still don't know why I'm not getting pregnant naturally. Nobody's ever specifically told me the answer to that, and that bothered me.
I looked at her, she looked at me and said, we need a different route.
A family friend of ours told me about NaproTechnology and how it is basically the natural way of figuring out why you're not getting pregnant.
We were a little skeptical to the fact of we didn't really know what it was, but we were willing to talk. So we went to Dr. Yeung.
I remember meeting Megan and her husband, and just a beautiful couple, but could kind of tell, like a lot of people, a lot of couples who have been through infertility, that they had had a hard time and a rough experience in trying to get pregnant. Infertility can be tough, and that it can really drive a wedge between a couple. When I described the approach of the Restorative Fertility Clinic, which has a basic approach of trying to basically find the problem and fix it, like in every other field of medicine. That's that simple kind of presentation. You could see like they kind of light up. They really connected or resonated with that approach. That was kind of something I think they felt was missing in their treatment plan or approach in the past, and they were excited about that.
He took a look at whether or not I might have endometriosis, and we decided to move forward with a surgery. And after the surgery, we continued to chart and try, and he kind of guided us through that.
He did some more blood work, and we found some more issues, low progesterone, other things.
I didn't know any of these things, amongst many other things, when I was trying with the fertility doctors and we did IVF. This was very eye-opening. These were answers to my questions. These are the things that are wrong, and it's as simple as taking over-the-counter pills or a few prescriptions. I think this was the only way that I had come across that was going to give me answers. It was a slower process. It wasn't immediate gratification, and that's always hard to swallow when you want something so badly, but it was going to give me answers, and I wanted answers. First month with all the medications and everything he had us do, we found out we were pregnant.
They thought it could never happen. They kind of thought, I think IVF was their last hope. And then when that failed, I think a lot of their hopes kind of were dashed. So when they achieved pregnancy, it was such a beautiful thing to be a part of, and they were thrilled.
I don't feel like there's anything better than getting, that pregnancy test that says you're pregnant at a surprise, so. Every day when I come home from work, it's the best feeling in the world. I mean, just seeing her change and just talking to other people about being a dad, and just seeing her face and how she changes every day, I mean, there's nothing like it.
Every single day, I thank God for her, and I thank God for the doctors who have figured this stuff out, and being a mom is indescribable and amazing.